Hello, and welcome to Fresenius Medical Services North America. Fresenius North America is split into two divisions, East and West, and across these two divisions there are over 2,000 dialysis clinics plus hospital-affiliated units. These clinics can vary from outpatient freestanding facilities to those housed within hospitals. These facilities provide service to large urban areas as well as communities 150 miles from the nearest city. Clinics are grouped by geographic locations under an Identified Director of Operations, or DO, or an Area Manager, an AM. This is done so that the DO or AM support the facility clinical manager, ensuring that clinic operations are operating under the proper guidelines required by federal and state regulations. Some of the day-to-day duties of the position include ensuring appropriate staffing ratios at each clinic, interaction with facility medical directors, preparing budgets, preparing reports, addressing employee HR issues, as well as participation in each facility's quality assessment improvement program and leading the facility's governing body meeting. Each facility has a designated medical director who is responsible for the quality of medical care provided to the patients. The medical director leads the facility's QAI program, participates in the facility governing body meetings, ensures staff receives training and education to perform their jobs competently. They also approve facility policies, procedures, and is responsible to review and approve all involuntary patient discharges prior to patient discharge from the facility. The medical director may also serve as a medical director at another facility, as long as sufficient time is allotted to cover the medical director duties in both facilities. For each individual clinic, there is a clinical manager who is responsible for everything that takes place within the clinic. Their responsibilities include managing the business aspects and the functional day-to-day operations. Clinical managers are also responsible for ensuring that everyone involved is communicating and working towards the care and well-being of every patient. The RN oversees all activities on the clinic floor and is responsible for the direct care provided to each patient during the dialysis treatment, as well as long-term treatment planning for a designated patient group. Each patient has an assigned physician to attend to their needs, often referred to as the attending physician. Attending physicians may see their patients in facilities to which they are admitted, their office, or in a hospital setting. To ensure continuity of patient care, it is important that the facility staff, patient care technicians, nurses, and clinical manager communicate patient concerns or issues to the physician during rounds, by email, or by telephone as may be necessary. This close working relationship helps to ensure that the needs of the patient are addressed timely and consistently. The patient care technician, or PCT, attends directly to the patient's needs from when the patient enters the treatment area to the time they leave. The PCT is the RN's right hand, providing information as to the treatment status for each patient and making adjustments to the treatment plan as directed by the RN or physician. The home therapy nurse provides care to and trains chronic kidney failure patients on how to self-administer home dialysis therapies. Patients and/or their care partners are trained to provide either peritoneal dialysis or home hemodialysis treatments in the comfort of their own home. In addition to those who tend directly to the patient's treatment needs in each clinic, other key contributors also need to be coordinated. For example, the social worker, who addresses the psychosocial barriers that may impede the patient's ability to adhere to treatment and maintain an optimal quality of life. The registered dietitian, who assesses patients' nutritional needs through a review of clinical, anthropometric, biochemical, medication, and dietary data, and then educates and advises the patients and staff on all nutrition-related renal issues. No clinic can function without the people that support the facility. These include the receptionist or office clerk, the education coordinator, the technical teams, and the treatment options specialists. The receptionist or office clerk welcomes each patient in a professional and courteous manner, making the patient feel welcome at all times. They ensure that records are filed and that equipment is ordered in a timely fashion, ensuring that the clinic is able to function at any time. An education coordinator (RN) works closely with each member of the clinical team to ensure that they are not only trained in the latest practices for their discipline, but they are also given the opportunity to develop their skills and qualifications to ensure the continued provision of safe, quality care to our patients. Treatment option specialists educate both inpatients and clinical staff using lobby days in different clinics. During these visits, they also see new patients to educate on different treatment modalities available for the care of kidney failure, including those who may be interested in dialyzing at home. Then there are the technical teams that maintain and service all the medical equipment, including the dialysis equipment. This equipment needs to be working perfectly at all times. Otherwise, it would deliver a less than optimal treatment and could present a risk to the patient. The technical teams are also largely responsible for the physical plant and all life safety equipment. A third area of responsibility is first-line response to disasters affecting our clinics. Altogether, these people work and communicate as a close-knit team, always relying on and supporting each other with a common goal of making the visit of every patient as comfortable and safe as possible. Welcome to the Fresenius family. Whether you are managing a clinic, working directly with the patients, or supporting the smooth operation of the facility, we hope you have a long and fruitful career with us.